Hey guys, nice to see you again. Let's enjoy Dr. Y's chest radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Chapter 33, Lung Nodule Images, second edition, part 2/2, chest x-ray and CAT scan findings. Today we're gonna enjoy the imaging findings, the pictures, paintings of the nodules, not reading a book time. So just relax and enjoy your time. Let's go. Nodule is, as we all know, a circumscribed, typically round opacity, less than 30 mm in average diameter. Let's start our scenic drive of nodule images. Let's go. Details are the common radiologic terms meaning indeterminate small lung nodules. Please watch carefully these three details, and guess what? What will happen? What will be will be. Que sera, sera. Couple of years later, the first one became bigger and confirmed as lung adenocarcinoma. And second one, it has grown up and confirmed as colon cancer metastasis. And the third one showed no change, same as before, so we regarded this as granuloma from infectious origin. These three details have different destinies. How do you feel if this nodule is yours in your lung? This old man's lung also shows this severe emphysema, reflecting the long history of his smoking. Our concern, the doctor's concern, and also the patient's concern is, what the hell are you? Are you a lung cancer, Mr. Ditzer? Yellow colored words are keywords, so please focus on the yellow words, yellow letters. This nodule is solid, well defined, and round. This nodule was confirmed as hamartoma. Coronal CT image, single, solid, polygonal, irregular margined nodule. These two images show us ill-defined nodules, peripheral location, ill-defined margin. Multiple, not single, ill-defined nodules. This is septic lung embolism, confirmed as Klebsiella pneumonia from liver abscess. Irregular margined, actually lobulated margined nodules. Colon cancer metastasis to the lung. Solid round nodule, irregular margined with speculation, speculated lung nodule. This is lung cancer with the emphysematous lung. Solid, speculated nodule with pleural tag, shown by black arrow, pleural tag. This was proved as adenocarcinoma. Subsolid nodule includes pure ground glass nodule and part solid nodule, PSN. Left side one is pure GGN, showing no obscuration of pulmonary vessels. And right one, part solid nodule. Central portion of the nodule is solid. This nodule is lobulated. White arrow indicates cystic portion and black arrow indicates pleural tag, suggesting pleural invasion, proved as adenocarcinoma. Yellow circle shows a round, solid, irregular margined nodule with cystic portion and non-calcified nodule, proved as tuberculous granuloma. Two yellow circles show us dense, compact calcification, showing us tuberculous granulomas. Another dense calcification with irregular margined nodule, calcified granuloma. 7 years ago, it was active pulmonary parenchymal tuberculosis. Today, it only shows dense calcification. On non-contrast CT of axial and coronal images, the calcifications are distributed along the periphery, showing rim calcification. We regard this as tuberculous granuloma, calcified tuberculous granuloma. Sir, you liked and subscribed. Thank you very much and be happy. The show must go on. The magnified view of the chest X-ray shows 2 cm ovoid mottled calcifications, but the axial CT shows all but calcifications, nothing but calcifications, dense compact calcification of tuberculous granuloma. Chest X-ray of left upper lobe shows us healed tuberculosis of multiple calcifications. Axial CT confirms the calcifications of the granulomas, dense calcified granulomas. Axial CT shows us 1 cm nodule with central calcification. If this patient is Asian, we can conclude this is from tuberculous calcification. If he is an European, we may conclude this is from histoplasmosis. Round, well-defined nodule with a central fat and 2 calcifications. In this case, we can say, yes, this is an hamartoma. Polygonal nodule with a fat density, minimum contrast enhancement, and no heart uptake on PET-CT, so we can conclude this is an hamartoma. These calcifications look like popcorn? If so, we can conclude this is a hamartoma. These two images are showing us miliary nodules. Left one is from adenocarcinoma metastasis, right one from tuberculous miliary nodules. Usually, the microbiliary nodules of the metastasis is more variable in size than miliary tuberculosis. This nodule is peripheral in location. The term subpleural is not recommended now. Pleural-based nodule. This nodule disappeared 2 months later, so we regarded this one as focal collapse. Coronal CT image. This nodule is periphyseal in location, not in fissure, not in the center of the fissure, but periphyseal. This nodule is also periphyseal in location. Left major fissure, confirmed as sclerosing pneumocytoma. On axial imaging on your left side, the nodule location is confusing, a little confusing, but on the right side, coronal imaging, it is clear. The nodule is fissural in the center of the fissure, ovoid, well-defined, lentiform, somewhat UFO-like configuration. The many arrows indicate pleural and fissural nodules, confirmed as pleural metastasis from lung cancer. On your left side, thin section CT, the nodule margins are more clearer than the right, a slightly thicker image. This patient also shows many pleural and fissural nodules, pleural metastasis from pancreas cancer. Black arrow indicates pleural-based nodule, and white arrows indicate peripheral location of nodules. 2 cm irregular margin, the pleural-based nodule decreased in size after 1 week. She has a pulmonary embolism, acute pulmonary embolism on her left pulmonary artery, so we regard this one as improved pulmonary infarction. Lobulated, spiculated nodule of left side increased in size after a couple of years. It was proved as lung cancer. 1.5 cm irregular margin, the ill-defined nodule decreased in size after 2 months, so we regard this one as infectious origin nodule. Originally, she is a DPB patient, diffuse panbronchiolitis. Her nodule has gradually decreased in size and stabilized. Avoid solid, gradually decreased and stabilized nodule, so we regard this nodule as infectious origin. Small, round, solid nodule in left lower lobe, showing no change, stable in size, so we regard this one as granuloma. Round, solid, irregular margined nodule with a calcification and stable in size, so we regard this one as granuloma. How about the scenic drive? Was it wonderful? Thank you. If you are interested in not only lung nodules but also in lung cancer, the most dangerous nodule, lung cancer findings, please visit my sites. 13. Lung cancer general. 14. Squamous cell carcinoma. 15. Adenocarcinoma. 17. Small cell lung cancer. 18. Lung cancer. 55. Micronodules. You stopped smoking today? What a wonderful day today for your loved family. Thank you very much. Please visit me repeatedly. Thank you very much. See you soon.